Ladies and gentlemen, we have now reached the final presentation of the session. The presentation titled Chun-chu Mega Pharmaco-Puncture Therapy in MOBON Treatment will be delivered in video by Hyunsam Lee, CEO of MOBON Korean Medicine Clinic. Let's proceed to watch the video presentation. 네, 함께 시청해 보시겠습니다.
Good afternoon. I am a speaker in this session. My name is Hyunsam. I am working at Osongdang KM Clinic in the 4th generation here, and I am also participating in the Association of KM Doctors MOBON to study further. Today I'm going to talk about Chun-chu Mega Pharmaco-Acupuncture. This is a therapy where many doctors of MOBON are using in their clinical field for more diverse and effective treatment. I am very happy to talk about Chun-chu Mega Pharmaco-Acupuncture therapy today. Now let's look at more details about this therapy. This is the content. I'm going to talk about the theoretical evidence of CMPET and some cases of, I'm going to share with you 4 clinical cases that we were able to help the patients using CMPET. MOBON is the Society of KM Doctors, and the CMPET is the result of our hard work to advance the acupuncture. In clinical KM, to increase the reproducibility of effective treatments while respecting differences in diversity, MOBON will put in even more effort, and the participation of skilled clinical practitioners will lead to further progress. We are opening clinical seminars and conferences to hone our skills still further. In Korean medicine, MOBON is going to make more efforts to increase the reproducibility of effective treatments while respecting differences and diversity. Then what is CMPET, or Chun-chu Mega Pharmaco-Acupuncture Therapy? MOBON doctors have been using CMPET for about 3 years now. This is the method of using Pharmaco-Acupuncture with intradermal needle insertion, which is considered as the central axis of qi and blood circulation at a constant rate to enhance immunity. Hypodermolysis is a method of administering fluids or medications subcutaneously. Is a way to provide water, salt, or medication into the body. In the photo, you are looking at auto-injector. This is a device that helps us inject a constant amount of fluids at a constant rate so that the patient can receive this therapy in a more comfortable manner and in a safer manner. The Pharmaco-Acupuncture uses wild Panax ginseng, Cordyceps militaris, and Astragalus membricius. Wild Panax ginseng is something that strengthens immunity, and Cordyceps militaris also has other effects such as anti-inflammatory, anti-tumor, and anti-cancer effects. And Astragalus membricius have been found to have effects of protecting telomeres and other anti-inflammatory characters. We use this pharmacoacupuncture for hypodermolysis, and we can ask for anti-inflammatory, anti-tumor, and anti-cancer effects. This will contribute to increasing the level of health and immunity of our patients. HDC, or hypodermolysis is one of a very important approach of treatment. HDC is a method administering fluids or medication subcutaneously to improve the patient condition, and is usually used for the elderly or mild symptoms, mild dehydration, or loss of appetite. These are several characteristics of HDC. Compared to intravenous injection, it is easier to administer, which means that the healthcare professional can find it easier to use HDC for injection. The fluid and medication is given to the human body through hyperdermoclosis, and we can quickly and effectively provide hydration, which is much easier and faster than intravenous. When using HDC, you can use physiological saline or glucose, these fluids, as well as medication. So, depending on the condition of the patient, we can provide different medication. There are several side effects from HDC, such as mild pain or mild bloating. But these kind of side effects can be solved after some time or after some light massage onto the body. So you don't really have to worry about the side effects. However, since this is an invasive therapy using the needle, so you have to be very careful about cleaning and disinfecting the needles, and we have to follow the quarantine procedures to prevent infection. HDC is a therapy to improve the conditions of the patients, and in CMPED, utilizes HDC very effectively to better care for our patients. In injecting CMPED, Chun-chu is the basically most important meridian point. This is where the key or the central axis of qi and blood circulation, which is so-called the celestial pivot. And it is quite easy to inject the needle. One of the characteristics of this meridian point is that we can alleviate symptoms such as abdominal pain or bloating. And especially, we can also treat the stomach and intestines. Basically, we recommend using the CMPED on the both sides of the navel point. However, you can also use other parts of the body, such as lower arm. Depending on the patient condition and the target of your therapy, you can choose the best meridian point for the optimal effect. This kind of therapy requires knowledge and experience of the KM doctor, and the KM doctor should also personalize their therapy to the condition of each patient. CMPED has several indications, and I'm going to list for you. It has anti-aging, antioxidant, and immune enhancement effects. It can also help the treatment of chronic diseases, autoimmune disease, and chronic skin conditions. It can also improve the physical weakness, so it is used not only for general patients, but cancer patients as well. Respiratory, digestive, and gynecological diseases are also some of the indications for CMPED. These are the benefits of a CMPED. We can use CMPED for patients who decline herbal medicine or patients who are challenging to manage with herbal medicine. And we can customize our therapy to patients because we can consider the conditions and the symptoms. We can choose the acupuncture point, which means that it is customized therapy to each of the patients. Another benefit is that we can also use the herbal decoction on top of the acupuncture. We can also prescribe CMPED as a complementary method and vice versa. And while using the CMPED, you can use other acupuncture such as Saam, Constitution, body acupuncture, or moxibustion or cupping. These are other types of manual or acupunctural therapies that can be provided along with CMPED. Now let's look at the procedures of CMPED. These are some of the preparations for this procedure. You have to have physiological cell line or 5% DW 75 cc's and 2 vials. At MOBON, we are recommending Mega M1 vials. And the procedure time depends on the setting of the injector. Basically, 15 cc's per side, so a total of 30 cc's are administered over 30 minutes. In this way, it does not bore the patient so much and it doesn't cause much pain to the patient. Of course, patients who need other types of acupuncture, who needs more resting time, then you can set longer time for this injection. We are recommending a CM pad once a week, and if the symptoms is more severe, you can provide CM pad twice a week or more. And if the treatment is going well, you can actually lengthen the interval to 1 time per 2 weeks or 4 weeks. And this can be adjusted according to the symptoms, which means that CM pad is a good tool for providing customized medical therapy. Now let's watch a video of injecting CM pad. We prepare 30 cc's of Pharmaco-Acupuncture and we connect it to needle. We usually use butterfly needle. You set the dose and the time. The bevel side goes to the top of, and then towards the other direction of the navel point, 45 degrees, and you inject the needle to the subcutaneous part. After injecting the needle, you tape it and make sure that the needle does not touch the muscles of the body. And you have to inform the patient that the acupoint may bruise later. You can inject both sides of the umbilicus or only one side of the umbilicus. Depending on the symptoms or the request of the patient, you can diversify your therapy. You inject the needle and tape the needle to the skin of the patient and then start the injection device. After the procedure, you use the ultra-red lights on the part. This will lessen the pain during the procedure, and it also helps the absorption of the pharmaco-acupuncture that goes into the body. Now I'm going to share with you the 4 clinical cases. These are the cases where CM pad was used standalone or concurrently with Western medicine or herbal medicine. The first case is a case where we were able to help conditions of hematologic malignancy. This is a case where MOBON doctors participated. Some of them was my case and others are other doctors. This is a male, 86 years old, and he was diagnosed with in March 22 a hematologic malignancy, but he declined anti-cancer treatment due to religious reasons. When he came to us, he was receiving blood transfusion every 2 weeks. Even so, his hemoglobin level was less than 7, and he had fatigue, loss of appetite, and lower back pain. The treatment period was 2 months, 20 sessions in total, twice a week. If you look at the kind of treatment, the basic treatment was CM pad, and other acupunctures were added on other meridian points. We did not use any oral medication. If you look at the progress, after the last treatment, the level of hemoglobin and CBC and the LFT were improved, and especially after diagnosis with the hematologic malignancy, his HB levels range from 6.5 to 7.3, but after the first batch of treatment, HB levels reached 8.3. The Western hospital that was caring for him also decided that he can stop blood transfusion. This progress showed that CM PET can actually improve the blood circulation, and he was able to save the patient from receiving further blood transfusions. The second case is a patient who was suffering night pruritus. He's a female of 67 years, and she had itching every night after having Omicron. She had rheumatoid arthritis. Her symptom was painful itching every night, which is hard for us to go to sleep. We gave her 3 sessions of CM PET. The treatment was only standalone CM PET. We did not give any oral medication. Looking at the progress note, after the first, second, and the third sessions, her itching was relieved, and especially after the first treatment, her itching was improved noticeably, and she was able to sleep soundly for the first time. And after the third session, itching remained only in the upper part of her head and almost completely disappeared. This showed that even with standalone CM PET, we were able to make some meaningful effects. This is another case of rheumatoid arthritis. These photos also show the progress. It is a 52-year-old male, Japanese-American, American-Japanese. No, it is a Japanese-American patient. He had morning stiffness and wrist joint pain. When he came to see us, the symptoms persisted even after the history of symphony injections in the US. However, his symptoms did not disappear. And when he came to us, he also had Raynaud's phenomenon in the hands and feet. Notably, the toes had previously suffered from frostbites, and such as include swelling and pain and ischemic necrotic discoloration, just like diabetic feet. The treatment period was 9 treatments, 9 every week. We provided CM PET in conjunction with intravenous pharmacotherapy, Saham acupuncture, and other types of acupuncture. In this case, we did not give oral medication either. After the 9 sessions, his morning stiffness and wrist joint pain both improved, and especially his 4th toe finger were improving from ischemic necrotic discoloration. We did not have the photo when he first came to us, but you can see from these photos that the 4th toe finger is improving slowly. This shows that through integrative therapy between CM PET and the Western medicine, CM PET has significant effect in the integration therapy as well. The last case is where we treated herpes zoster after anti-cancer treatment. Our patient was a female in her 60s, and after she had onset of herpes zoster in the same area after previous occurrence after anti-cancer treatment. Because the patients who are going through anti-cancer treatments, they have often reoccurrence of herpes zoster. She had a lot of vesicles from the thoracic region all the way down to her chest. Because of her stroke, she was not able to she was not able to say exactly what pain she had. There were 9 sessions overall. We gave CM PET acupuncture treatment for thoracic segments, and we also used other medicines such as 공진단 and 생혈구. And we disinfected the vesicle area and JS ointment. If you look at the progress, even after the first treatment, the patient reported severe pain and spent the entire day lying down without eating anything. However, As we moved on with our treatment, her pain was slowly disappearing, and after the 9 sessions, most of her vesicles have resolved. Both the pain and the pruritus have also improved. This is a case that shows that CEM PET can actually help healing the herpes zoster of cancer patients with weaker immunity, showing that CEM PET can be used for anti-cancer treatment patients as well. So far, I have discussed CEM PET or Chun-chu Pharmaco-Acupuncture. CEM PET could be a versatile and effective approach in traditional Korean medicine, offering a holistic effects, diverse treatment options, and the ease of procedure with minimal side effects. We hope that we can promote the excellence in traditional medicine through CEM PET. Thank you for listening. The traditional medicine in Korea and the Korean medical doctors are not going to remain in the present. We will move into the future. Thank you very much for introducing CEM PET, Dr. Hyunsam. Once again, we thank you.